All right, everybody. So we are 3 minutes into the hour. We will keep an eye open for when our colleagues decide to join us. So I want to thank everybody for joining us today. Thank you for joining the first round of working groups for the Westward Choice Neighborhood Plan. My name is Andrea Gonzalez. I am a member of Collabo. We are the planning and design firm that is leading this effort in collaboration with the Greater Eastern Partnership, as well as the Housing Authority and the City of Easton. So my name is Andrea. I'm happy to help. And do you guys want to take a minute to introduce yourselves?
Sure, I can go next. So I'm Adam Rosa, I'm with Collabo. So as Andrea mentioned, we're the planning coordinators. We've been working in the Westward for several years, and we're really excited to continue the relationship and learn from the community to create a transformation plan. So thank you all for being here. Amy, you want to go next? We'll see if she can unmute.
Morning, everybody. Sorry, we're in a, well, long story. Anyway, hi, everybody. Amy Bacadoro. I am the manager of the Westward Community Initiative here in Easton, and have been working with Adam since he did our initial plan back for the neighborhood a couple of years ago. And I also want to let Tanya introduce herself too. She's in the room with me.
Hi, my name's Tanya Ruiz. I'm the new assistant manager. I just started on Monday. Super excited. Nice. Okay.
Fantastic.
So great meeting you, Tanya. We have PE Brunswick on the line. Do you want to introduce yourself? Your mic is open. And this is also for our purpose of attendance records. It helps us keep notes.
Sure. Good morning, everybody. Glad to be here. I'm Paul Brunswick. I'm president of the Two Rivers Health and Wellness Foundation. We're located in the West Ward at 11th and Northampton Street, right next to Cottingham Stadium. And so we've been involved funding health and wellness programs throughout Northampton County. So pleased to be part of this group.
Great to have you. Great to have you, Paul. So why don't we get started with the presentation? So before we get started, I want to do a little recap of what we have been doing here as part of the Choice Neighborhood Plan for Easton. So the city recently won an award, a grant award that allowed it to create this plan. And what is a Choice Neighborhood Plan? It's a plan for the whole neighborhood. And not only are we talking about housing, but we also want to make sure that the plan is comprehensive in a way that it can benefit everybody in the neighborhood, not only like the residents. We also want to be involved with businesses, local partners, and city government in order to make an effective plan that is going to work for everybody around here. So the project is definitely focused in the westward area of Easton. We have close to 10,000 residents, and the area is around 1 square mile. However, by being familiar with Easton, this 1 square mile can feel really, really, really big when you're walking and you are faced with all the hills up and down that are everywhere around in Easton, right? So the way that this process works is that at the beginning of through last year, we were in phase 1, where you guys saw us out there in the community in some public events like the annual night out at Paxinosa, where we did this listening and learning exercises. We have been out in the community doing surveys, making sure that we can capture the information of and the experience of residents who actually live and work here. And we want to listen and learn what are the most immediate needs of the community. Then when you saw us out at Paxinosa in the annual night out festival, we did this visioning exercise. If you guys remember, we had an artist on site who drew a huge mind map using the feedback from the community. So when we are through this working process, we're going to be referring to that mind map. I'm going to be showing it next. And it is to help us envision really what our ideal community, or how do we want the community to look like as a result of the plan. Right now, we are right in the middle where it says strategies for program and projects. So this exercise right now, the working groups, this is the first round of 3, one in February, one in March, where we are all going to get together around this table. And the whole purpose of this stage is to find and brainstorm solutions to the issues that we have been identifying through the last year in the project. The strategies are going to lead to people, housing, and neighborhood elements that we are going to find through this process. And then at the end, the goal is that we create a plan to actually implement these elements that we're identifying in the process right now. So far, anyone has questions? Okay, so we're gonna keep moving along. As part of the program, we identified 3 target housing sites. The one is the apartments at North Union. You guys are probably familiar, North Union in Hampton. So we have 57 apartments there, housing about 139 residents. It's a fairly large site at 3.1 acres. And right now, as part of the process, we are exploring how could we possibly redevelop the area in a way that no one is displaced, in a way that if we currently have 139 residents, all these 139 residents can come back home. But at the same time, what could we add as an element of design in this project to make the housing, to make the neighborhood, and to make the people, everything for the people, better for them? We have 2 other sites. One is the Bushkill House down on Locust Street, and also up the hill we have Elm Street Apartments. So the Bushkill House is senior housing, or housing specific for senior and disabled residents, while the apartments on Elm Street are family. We have multifamily homes and multifamily apartment buildings there. So these are the sites where we are mostly going to focus our housing interventions. However, like I said, the project is for the whole community. It extends beyond just talking about apartments. We want to have a conversation about the whole community. So that's the purpose of these working groups. Today is our second meeting. We are on our second working group out of 5. And welcome to the conversation around community health and safety. So you guys remember this picture is from the day that we did the mind map. So I will be referring to this drawing, the one on the back, because it's going to inform the conversation that we're going to be having today. As part of our community engagement, we rolled out a needs assessment survey, which consisted of a very, very, very complete survey. It was close to 100 questions. And we got about 60 to 70% of residents on the target sites to answer it. And what this needs assessment is doing is that it is helping us identify those areas that need most immediate action. And it has allowed us to start conversations directly with the community, because we are hearing from them firsthand their experiences living there. So, so far, anyone has questions? Are we ready to begin? Yes.
I have one question. Elm Street, I understand you just went through that as families, and the Bushkill is seniors. What about North Union Street, the demographics? Is it families? Are there children? I'm a little, I should probably know this, but I don't.
Yeah, I can jump in on that. So it's essentially, it's a family site, but there are a pretty good number of senior and disabled people that also happen to live at North Union and at Elm Street. So they're, as far as HUD considers them, they're family properties. But we do have challenges at both properties with people able to get around, like the topography, the sidewalks, all of that stuff is a challenge.
So there aren't any age requirements. Okay,
No, not at those two properties.
thank you.
Thank you. Thanks, Adam. All right, so I'm gonna briefly introduce you guys to a mural board. So if you guys can see my screen, imagine if we were in person, we would be having one of those like huge paper boards that we just roll over, right? And we write and we put sticky notes on it. But unfortunately, due to COVID, this meeting has to be virtual. And this is the board that we have right now. So at the top, here is this little drawing of our neighborhood. This is the area of the Westward where the plan is focusing. At the bottom, we have colors. Red is for housing, green transportation, yellow is community health, blue for equity and inclusion, and pink for art, history, and culture. Today, this is the meeting of community health and safety, so we're going to focus on everything yellow today. Or orange. Well, you guys decide because so this is a quick refresher of what the artist drew on the mind map. So the things that we heard from the community at our public engagement efforts have been that the community wants to support mental health. They want adult education, science classes for kids. They want to see data. They want, so probably this is speaking to us after doing the survey. We should definitely find ways of how to share the data with the community, right? They want us to coordinate existing resources and leverage and distribute existing resources. They want fresh markets with healthy food, more access to fruits and vegetables, enable residents to be aware of communication and information, community health and safety. They also say that they want better and brighter lighting at night. They want more police presence, pop-up clinics, more doctors and offices. They want to see more police patrolling. They want gun safety campaigns. The playground on the site at Union Street feels unsafe. They want more sports programs, community gyms, and jogging paths. So this is a part where we are going to open the floor to you guys, and this is where we want to hear which of these ideas are resonating with you and how can we make it better.
So Andrea, before we go into the discussion, do you want to take a quick look at some of the survey results as well at the bottom?
Oh, you're totally right. Sorry about that. So just as a quick preview of the survey results from the survey effort. Oh, we have someone coming in. Yay. From the survey effort, the quickest takeaways of the initial results is that disability and senior services are the most required. So there was a question asking, what kind of services do you need? And we gave them like 20 options. So the options that were most popular were disability and senior services, as well as fitness and chronic disease management. From the survey, we also learned that 35% of residents feel somewhat safe. So what does this mean? That there's room for improvement, right? And that's what we're here for. We want to find ways that we can improve these results, right? From the options that we gave the folks on the survey, they indicated that better security cameras, outdoor lighting, and visible patrol would definitely increase their feeling of safety in the neighborhood. And another thing to point out is that 20% of residents reported being in poor or very poor health. And also we have 68% of residents with a disability in the neighborhood. So that's a really, really high number. Just that we keep it in mind when we are brainstorming for other ideas. So do you guys want to get started?
I think that speaks to the a large number of people who took the survey were residents from the Bushkill House, and a high number of those residents have disabilities.
And also being seniors or being like dedicated senior housing, I think that there's a lot of like conditions that would qualify them as this disability. Great, so we are here again at the mind map where I'm gonna zoom in and does this work? Do you guys see it? Great, so why don't we get started? One moment, I want to see my participants here. Hi, we got a new participant. Do you want to introduce yourself just for our attendance records?
Thank you, Andrea. Hi, everyone. My name is Rosemary. I am with St. Luke's Community Health. I'm the Senior Network Director, and I'm really apologize for being 15 minutes late. We have another meeting with our liaisons that I lead, and now that I'm part of this group, what I could do is change that meeting for the next time so that I can be on the call at 9 o'clock. So I know it's disruptive coming in late, but very excited to be on this committee and worked in Easton when I first became a liaison for community health. So I'm really excited to be back and part of the team. So thank you.
Thanks for joining us. We're very, very, very happy to have you. So I understand that you were a bit late and that's okay. So I just wanted to explain to you that this is a mind map. We had an artist on site sometime last year when it was the National Night Out Festival. So the artist drew this mind map just from community feedback that she was getting on site at that time. So do you see any of these ideas that like immediately catches your attention? Or anyone?
I'm curious. I see what the survey results say, and that's how people feel. But do we have any data that I was taken by the 35%, only 35% feel safe? And it came up a couple times. And this has come up over the years when we were doing a thing at Paxinosa, collective impact study, the same thing, same feeling. But when we looked at the police data, it showed that, you know, crime had really dropped quite a bit. And I'm just curious, is that do we have access to that kind of data, Adam?
Yeah, we should be able to get that. We have a couple of police officers that are part of this committee. They just weren't able to join today's call.
Oh, okay.
Amy, did you want to jump in on that?
Yeah, Paul, we've actually pulled crime stats for, can you hear me okay?
Yes.
No,
Sorry.
I'm having trouble hearing. Sorry.
Let me come closer to my laptop a little bit. Better? Is
Yes,
that better?
thank you.
Yeah, we pulled crime stats for the market study that we're doing right now for housing. And yes, you're right. Over the last 5 years, they've dropped substantially.
Right.
Also, I think those survey results are respective to the 3 housing sites, not the entire neighborhood.
No, yeah, Amy, and I that was my second question, and I assumed they were. I mean, that's important.
Yeah, absolutely. I think there's the security at the Bushkill house is could definitely have some improvement to it. And I think we've talked to about like the different one-way streets, especially at Union, can kind of create a weird traffic patterns, and Elm Street is kind of tucked away too. So I think those are all pieces that play into this as well. But yeah, I would agree to that.
Sorry, go ahead.
I also want to point out that thanks, Amy, and also thanks, Paul, for your question. I also want to point out that the majority of the residents who answered the survey are women. And definitely the feelings of safety for women are different from what a able-bodied male would feel walking down the street.
Good point.
I was just going to say, I think it also gets to the notion of the perception of crime versus the reality And I know that can be an issue that is harder to overcome because people get set in their head about how safe an area is over decades of time. And while the crime may be dropping, there's still that perception that at least parts of the Westward may feel unsafe. So I'm not sure if that's kind of what you were getting at a little bit, Paul, there.
Yeah, it is, Adam, and I agree with you because people today still that I talk to say, I'm not driving through the Westward. You drive through, and it's I don't find it that way at all. I mean, there was a time when 20 years ago when we first came into being, when the gangs were running wild, everything was ending up getting tagged, and I think the city's done a great job over the last several years in getting control of that. And it just seems like the message, I don't know how we do it, but I guess the message isn't getting across, or the perception. So two different issues. I agree with you.
I think that maybe we can, thank you so much, Paul. Like really, I think what both of you guys are pointing out is the perception, or maybe the Westward already has a connotation that is unsafe. And maybe what we could discuss is like, how do we change the idea that people have right now? And perhaps this is an opportunity for design interventions, things that people said here, more lighting, for example, could definitely be one of those things that start building up towards feeling of safety.
So Andrea, first of all, I love the mind map. It's amazing. And it touches on so many things that we hear again and again, where it says more police, please. And I know that means police present, patrolling, and so forth. But I just want to make sure that this committee is aware of Ryan Seipel, who is the Community Affairs Officer with the PA State Police. He's actually in a meeting with Community Health right now that I'm not in because I'm in this one. But he's working closely with some organizations in Easton. Is anyone familiar with Ryan Seipel? Okay, all right, good. Just want to make sure, because he wants to get more involved, and I think that might be a nice asset too. So I'm glad to hear you guys are working with him, and this might be a nice place to bring him in to brainstorm as well. But you might already be doing that.
Thank you. It's great to see that some of us already have the connection right there, and hopefully in the future we can invite him to this kind of meetings.
So can you say his name again? It was Ryan something?
Yeah, it's Ryan Seipel, S-E-I-P-L-E. He's Community Affairs Officer with Pennsylvania State Police. And I was in other meetings with him, and he's like advocating, like even to work with the youth and build a presence where they're seeing that we can grow a trust for law enforcement as opposed to a fear, and trying to get youth more involved in different recreational activities. Like he wants to get work with us to get vouchers to Blue Mountain Ski Resort and so forth. So just really impressed with his advocacy and efforts and willingness to partner.
That's great to hear. Thank you. Amy, have you had any interactions with Ryan?
Yeah, I was introduced to him through our Easton community police officer. He came out and participated in our National Night Out program, and he promised me a helicopter for next year's National Night Out. So yeah, he's a good guy, absolutely. Adam, he was on the grill that evening, if you remember.
Oh yeah, okay.
Yeah, so that's him. Yep.
Great.
So Paul, I know that you guys are located kind of right in the center of the community. Do you have specific security measures that you take to make sure people feel safe coming to your facility?
Yes, we have cameras all over the place. Our parking lot, the rear parking lot, is on Church Street, which is between Cottingham Stadium and when we first started here, when we first went into that facility, we had cases where we'd find abandoned cars We'd find underwear and stuff, all kinds of stuff. And so we ended up putting up numerous cameras. And our tenants, like we have a Pine Brook, who's a mental health provider. When people come in the back entrance off of Church Street, they can see who's coming in and who's not. So we have the same thing on the bottom floor, plus alarms all over the building. But we have seen, it used to be that it was like every other week that we were having to clean off the building from the gang tagging it. And once the task force took place, I think it was that, I forget what the name of that effort was, but it was a good one. And the police would come and clean the stuff off as long as, and then we would repaint the building right away. And I've noticed a big difference throughout that part of the West Ward in that, which is a good sign.
Thank you. That's really, really great to hear. So one of the things that I noticed from the survey, and also somewhere around here on the board, it really said that increasing cameras or putting more cameras, I'm trying to find it here on the map. I can't remember where I saw it. So I think that they could be effective in this. Can you guys think of other interventions that would help in the health and safety of the West Ward?
I think the illumination thing was a big point.
Definitely.
You know, even in some of the suburbs now where they're cutting back, it makes a big difference if you don't have that lighting, and it's dangerous.
Mm-hmm.
I think that's a really good point.
Yeah, I was going to go to that point as well, Paul. I think one of the things that we've talked about for a few years is doing a kind of a community porch lighting initiative where you would provide some sort of incentive for, well, you would provide people with free LED lights and maybe a stipend for the electricity costs to keep their lights on at night on their homes. So that, I think I see Amy with her hand up. That might be something that's kind of moving forward.
Yeah, we started that before COVID. It's called Lights On. So we provide an LED light bulb and then also a sensor that gets screwed into the outside light so that it goes on automatically at night and then it turns off automatically in the morning. So it's really like a set it and forget it. Totally free. We will provide them to front porches if they live on a corner and they have a side entrance, or depending on how their back alleyway is, we've also provided them those for those places as well. So offhand, I want to say we've given out well over 150. It could be more. Obviously with COVID, we haven't been at events to hand them out, and that's primarily where we get them out a lot. So yeah.
The thing I wondered about when I saw that listed on there was, are they talking about street lighting? I mean, I have to admit, I haven't been back in there at night, so I have no idea how well lit that is.
Yeah, I would agree, Paul. I mean, even with folks having porch lights on, the overall darkness of the neighborhood is still there, and street lights are at the corners and at the corners of alleys, but it's not with tree coverage. It's, I mean, there's the double-edged sword of trees is that it just doesn't always illuminate the neighborhood. The city recently installed these fantastic lights on Northampton Street that they've been slowly working up the street with, that have a lower pedestrian light to them, which, I mean, the difference is really phenomenal, because when you cross over from not having one to having one, it's really, you really take notice to it. Those things are so blasted expensive, but I feel like that's what they need within the neighborhood. So yeah, I don't know what that what that answer is. Yeah.
So quick
Meaning-
question, are you guys involved closely with Kim Kometz with the Easton Main Street Initiative? And, okay, because also, is anyone part of the PA Downtown Center with the state Main Street initiatives? Okay, because they always have great things that we can kind of glean and best practices. So I've always been impressed with what they have been able to do. Is Kim
There's-
Kometz on any of these, or is anyone from Easton Main Street Initiative on any of these committees?
No, they focus, so they are a program of my nonprofit of GEDP. So they focus primarily on downtown. That is their focus. And then my program is Westward. So that's our program focus here.
That's interesting, just because if you're not focused on West Ward, you're not going to help downtown. You know, it's how do you do one without the other? They're so interconnected. But
Yeah, I was actually the previous assistant manager for Main Street. So I was there for, I volunteered for about 9 years before I was hired there. And then I was in that position for 5+ years before moving over to for Westward. Yeah, so I'm very familiar with PA Downtown Center and went through the Main Street program there. And yeah, we absolutely see things working together. But this is a little bit more focused on Westward, so comes into my world here.
gotcha. Okay, that's great update. Thank you, Amy.
Are there cameras? Has the city installed any of the cameras, the area type cameras where they can see it through the whole streets and stuff in that part of the West Ward? I know they have up near us.
Yeah, Paul, and I just want to mention these comments that are on the mind map were for the entire neighborhood. So they weren't specific to Elm Street or Union Street.
Oh,
Yeah, so I know, like you mentioned, the city installed new cameras, especially along Northampton Street at the traffic lights, but I don't think within the Elm Street. I do believe there is a camera right up there around 10th Street where the Elm Street development comes out. I know there is camera access there, but within those, I don't believe so.
Yeah, not within the housing authority developments themselves.
yeah, that's
So speaking about community health, so I also think that having like more constant or I don't know how you guys would feel, especially for the site at Bushkill House. Just from talking to the residents, one of the things that has come up is that they feel like there's a feeling of isolation as to like if anything happened like to them while they are there, like how would they let anyone else know outside Bushkill House? So what type of interventions or what type of solution could we find for those? And we don't have to have all the answers today. Yes, a lot of these things like these are not easy challenges.
you know, so what you're saying, Amy, is that the mind map is really based on information from throughout the whole West Ward, not specifically to these. Oh,
Correct, yeah. But
thank you for clarifying. Thank you for that. Makes a lot more sense to me on some of these issues that I saw in there.
Mm-hmm.
And then
Okay.
the survey, and then the survey results that are below this, those are specific to the residents. So yeah, so we have kind of two pots of data here
Oh,
that we're
okay.
sharing. Yeah.
So you all are in the health world, and what are your thoughts when you see comments like we need more pop-up clinics. We need better mental health support for local residents, 24/7 doctors on call. And I know this is only, a lot of this feedback came right in the middle of the COVID pandemic as well. So I'm sure that there's some connection to that, but I'd love to hear your take on some of what you're seeing here related to health.
Well, I think, and Rosemary can really comment on a lot of this, but just from my standpoint, the fact over the last 5 years or so is that the establishment of the federally qualified health center at 11th and Northampton Street that has to take, regardless of income, they can't turn anybody away. They're in our building, and then there is the same FQHC lookalike in Easton, the wellness center. So I think those are two major pieces, and St. Luke's has taken over Easton Hospital, and I think that's made that was dying off pretty rapidly, and it's making a substantial turnaround there. And plus, now we have Lehigh Valley Hospital in the area. So at one time where we worried about where we're going to have any hospital here, now we have 2 hospitals, which is great. 3 really, when you look at the location out on St. Luke's out on 33. So from that standpoint, as far as doctor practices, I can't comment, but as far as people having access to just walk in, I think it's improved substantially.
Yeah,
And I know that there's expansion planned for that as it goes on.
yeah, absolutely. Just to reiterate what Paul said, we've come a long way. Even I've been with St. Luke's Community Health since 2014, and I just can't even believe how far we've come. So Easton Hospital, thank goodness it's still there, and we're still embracing that. And we have and LVHN, and then St. Luke's Anderson as well, and the federally qualified health centers. We even have so our affiliation is with an organization called Star Community Health, and it's not just primary care, but also OBGYN right there in Easton, and we also have dental there. So the other goal of community health is to take healthcare for all outside the walls of the hospital with our community health workers and our connection to care. And the president of Easton Hospital, Linda Grass, is very open to being part of these conversations and discussions. And she's got a lot of great ideas. Right now, even we have a professor from Lafayette working with local students to bring the arts into Easton Hospital, to bring Easton art into Easton Hospital. So there's that connection. Now that's inside the walls of the hospital, but again, she's welcome to be part of these conversations to brainstorm other ways we can kind of build that trust. So just how we want to build that trust with police in the schools and in the businesses and in the organizations in the Westward and with the community members, we also want to build that trust with healthcare and let them know we're there.
Definitely.
Like we just got off the phone, we were having conversations of, we like to promote literacy, and we're going to have maybe Linda, but probably some of those providers from the FQHCs read some books, and then we'll get it through Paxinosa. We'll get it out into those students, send the links out, and so forth. I mean, we usually go in the classrooms, but now with COVID, we're not able to do that this year, but we're going to at least for the time being, get them out through video and then try to get back in as soon as we can, because we need to build it from a prevention effort from the beginning.
Definitely.
Amy, from and I noticed the mental health, I don't know if it was on the bottom, but it was on the mind map, access to more mental health. I think it would be great if we could get Pine Brook, who is now in the West Ward in Easton, that is, family programs as well as kids, to be part of this work group.
Do you have a contact there, Paul, or
Yes.
would you like to invite them?
Sure, I'd be glad to.
Thank you.
I also want to echo one of Adam's comments. So oh my God, I am forgetting your name. Sorry, ma'am
Ro-
from the Lehigh
Rosemary.
Valley.
Oh,
Yes,
yeah, Rosemary, yes.
thanks, Rosemary. So I think that you were when you got in the meeting, I was just going over the survey results. So I think that what you're pointing out about the community partnerships that your organization is building is fantastic. I definitely want to encourage and support more of those initiatives. But here I just want to go back to the results. In green are about transportation and yellow is about health and safety. So I want to point out that the most impactful barrier to access to services is the transportations. So in the Westward, we have 49% of residents who don't drive. And that's a really, really, really high barrier for anyone specific, especially for seniors and disabled folks like to access health services. That's huge. However, there's also the environmental barriers that there are not enough areas for people to engage in outdoor activities, or there are not enough areas where they can access healthy foods. So I think that we are looking at the community health issues as as a greater challenge that is not only specific for one area. I really think that we really need to have an integral approach of including transportation, including like the safety, and I mean like the police and like that kind of security services and providers, as well as with you guys as health providers. So thank you. I just really wanted to point that out. Anyone else had a comment about it? Because it really got my gears turning and I need to think about it.
Is the work that was being done with the connectivity, you know, I forget who
Westward Mobility Plan?
Yeah, yes, that's it. Does that come into play here at all? And would that impact these areas that were, it seems like, I'm looking back, it was a long time ago that I saw that, but it seems it would be of help. I mean, this transportation keeps coming up throughout the whole area. No question, it's a big thing. The same with the grocery store, you know, access to food and that type of thing. And there's a lot of things going on that the Westward has been doing with their gardens and the Pine Street. So there's a lot of activity going on, but I would agree, those are really important issues.
I am having an idea. I have seen this done before in bigger cities, but I don't know if this could also work in the Westward, to bring people outside, to get people engaged in physical activities or doing things together. Like that's also like capacity buildings. Have you guys explored, or would there be an opportunity to explore outdoor fitness programs, like public outdoor fitness? Like let's say Zumba class at the playground. There's this playground there that feels unsafe. So if there's a Saturday Zumba class at noon, it immediately brings people out. And then when you see people in a public place, all of a sudden it doesn't feel so unsafe. So yes, Amy?
I think that would be amazing. I think one of our barriers is that we just don't have parks that are big enough to sustain that kind of activity right now. Hopefully when Vanderveer is redeveloped, that will create a much needed large green space, because we just lack open space that could hold something like that. Yeah. And a lot of our focus, I agree, I would love to see more adult classes too being held. A lot of focus has been really on kiddos and making sure that they're involved in some kind of team sport, but I do think that adults would be also well served for these kinds of classes. Yeah.
Yes, exactly. So not only Zumba classes and classes for kids, I have seen Tai Chi at the library, and that for some reason that always attracts a lot of seniors or some type of like gentle yoga. I have seen those like at the library, which is not even like a senior dedicated space, but like that's where people go.
So
Well, you know,
I was gonna say, I'm gonna put something in the chat that we did years ago, but it's still on the Pennsylvania Department of Health website. We developed a walking path around Paxenosa with a state group called WalkWorks. So I just put the link in. So that's still there, and it highlights Easton Public Library, the State Theater, St. Luke's. We highlighted dental because dental is also an issue, although it's not on the mind map, I don't think. But the lot spot, and this could be outdated, but it would be an easy fix. Walking is something that is equitable because it's easy for everybody. And Easton, what makes Easton's walkable. We had done a assessment with Department of Transportation, a walking assessment on the curbs and the sidewalks, and we have that. Again, that's probably outdated now, but we did work with Dave Hopkins in the city. I don't know if he's still there, to kind of do some minor tweaks with some, let's get some cement, fix this sidewalk so it's safer to walk. So if you're going to promote walking. So I put the one, we did 3 routes in Easton, but Paxenosa we really want to do. And there was even a time, at the time we were discussing like how to have safe walking routes to the bus stop, because I know when we did our assessments and we found out that even community residents weren't comfortable walking. And I don't know if you've been hearing that lately, but even though it was so walkable, they weren't comfortable walking to school. So I just wanted to make everyone aware, because sometimes instead of starting fresh, we can kind of look at what we used to do and tweak it if that works.
That's great.
Yeah, thanks for sharing that, Rosemary. I wanted to just go back to one thing you mentioned previously about literacy programs in the neighborhood. So we recently installed 4 little free libraries at North Union and at Elm Street. So if there's a way to kind of, coordinate in terms of just book distribution through our little libraries, we'd love to be able to help with that, at least on property. And we can do the same at Bushkill House. So that was one thing. And then the second thing was just that the idea of, and I'm not sure if this may exist already or you may have thought about it or planned it, but any kind of mobile health clinics that could go deeper into the neighborhood to go to a place like the Bushkill House and provide service. Is that something that would be viable?
So we could look into something like that. I can't speak for LVHN and I don't know what their plans are, but St. Luke's, we are rotating now with Project Easton. We're rotating our our family medicine residents through to help, because they're doing so many neat things, and I'm sure that they're part of these initiatives in some way. But yeah, one of the some of the residents were just put on hold because of COVID, but then we have other residents that we're interested in. So they're going to be helping out with the food pantry, helping out with adult literacy, some kind of like also just talking about health and what to look for and things like that. So the Bushkill House, maybe we can talk with them and see. We have a new liaison, Jackie, who's on the equity committee, and she's been meeting with different partners. Then we bring in our president. So like with Project of Easton, we had a meeting, we talked to them. We brought in both the president of the Anderson campus as well as Linda, who I mentioned from the Easton campus, and talked about how can we work together? How can we support, again, outside the walls of the hospital, because that's what community health is really about. And came up with some really good ideas. And so we can certainly look into that with the Bushkill House, and I'll put that on my follow-up with the team to talk about, and then I can share any updates when we meet next.
Adam, to get back to your literacy issue, Project of Easton runs a adult literacy program, and there's another program. It's called ASQ, Adult Skills Quest, that meets at the library, the Easton Area Library. Now, I hate to bring this up because I have a conflict of interest because my wife runs that program, but it's work and a number, I don't know how many now, but I know that out of these 3 locations that we're looking at, there have been a number of people that have come into this program. It's a program. It's run by ex-teachers. The superintendent of schools has attended just to see what's going on there. The mayor actually married a couple at one of their classes. Sal will remember that. So there are those programs. It's a matter of getting people to understand it. And again, transportation is an issue, and the way that they've been trying to get around, they're using the suburban ambulance EMS guys will send a van out to pick up people from all over. A lot of the people are from the West Ward that go to these programs, and there are people that are going for GEDs or for second language. So between Project and ASQ, there are those programs that could probably be expanded. They're nonprofit. They're totally volunteer driven. As I say, I know the ASQ program it's teachers, retired teachers that do it. It's not perfect, but it's amazing what they work with these people. And they are older, most of them are older adults or parents that didn't have any knowledge, but now out of this, they've learned to be able to work with their kids when they bring the homework home. So there are some things
Awesome.
to be looked at there. No question about it.
Yeah. And Adam, I don't know if it would be you or Andrea or Amy, but can someone send me and maybe everyone the where the 4 Little Free Libraries are located? Because what we can do is try to promote that when we promote literacy efforts in Easton.
They're on the website, Rosemary. If you go to the westwardeaston.org and then to the Choice Neighborhood page, all the way at the bottom, they're all listed on there.
Great. Okay, awesome. Thank you, Amy.
This is great, guys. Keep it coming. We are having like really, really awesome ideas right now.
We haven't talked too much about healthy food. And I know that there are some great programs in the West Ward related to community gardening, related to food distribution, etc. But I just wanted to, I see Amy has her hand up, but wanted to kind of get your take on that challenge.
I just wanted to comment that we're hopeful to start a market, an outdoor market this year, working with Kellen Foundation, working with the Veggies and Community Stand, also bringing in some other local farmers and food purveyors, so that there's bread and milk and eggs and cheese and so on and so forth that are available. We're hoping to make it an evening market and hold it along 12th Street adjacent to Paxinosa, but so between Paxinosa and Cottingham Stadium. We are working with Megan from the Easton Farmers Market to find additional vendors and also make it a community event too. So there's reason to come out and stay, things to do for the kiddos, some kind of food, ready to eat food option and music and so on and so forth. So it becomes an active space as well. We're working with the YMCA to do some programming there too. So kind of trying to round it out and let that grow a little bit too, and see what else the community is looking for. Because as Paul can attest to, Kellen is very successful. The Veggies and Community Stand is very successful. So just trying to build on that. So it's also open to the entire community, because we do feel that there are folks that shy away from it because they feel like they have the means to buy fresh produce, so they don't come. So it creates this have and have nots scenario at some of these situations. So trying to give everyone the opportunity to come together. And a lot of things that Kellen and the Veggies and Community Stand offer can be underwritten, and EBT will be available at this market as well. So it can really, break down some of those financial barriers for folks and bring it right to the community. Because again, back to transportation, not everybody can get downtown to our farmers market on Saturday. And then, get home with groceries and kiddos and that sort of thing like that.
definitely.
Amy?
That sounds awesome.
Mhm.
Amy, I know there've been several efforts to try and get a grocery store, year-round grocery store into the West Ward, and either because of zoning problems or is there anything going on in that area right now?
No, and it's not, I don't even know that it's so much of a zoning problem. It's really trying to find a grocery store that sees this as the correct demographic and that it will meet their financial standards. There's, you know, the loading dock and finding something that is of substantial size are two
Yeah.
like physical barriers. But really trying to court a grocery store here is really difficult, especially when you know, can go 2 miles to 25th Street and there's 3 sitting on opposite corners of one another. So it makes the competition so hard. And I think that's one of the pieces that we're trying to, you know, we recognize that, you know, in talking with Eric from Kellen, I don't see a grocery store in the next 5 years coming here. It's just been such, you know, such an effort for, I mean, as long as I've been volunteering and working in Easton, we're going on 15 years now. It's been talked about, and it's just really hard. There's so many obstacles and barriers to it.
Yeah.
So, yeah.
Yeah, no question about it. I mean, we're landlocked.
Mhm. Yeah.
There's just no area where we could have the
Yeah.
parking type thing, but I thought they had made contact with some outfit out of Philadelphia that went into areas like this. I might have my
Paul,
meetings mixed up. Maybe maybe it wasn't the Westward Steering Committee, but somewhere along the line,
Paul, you're right, though. We did, Adam, that was the example that you had in our neighborhood plan that we had talked
okay,
about.
it was in the neighborhood plan, right?
Mhm. Yes, yes.
Yeah,
Yeah.
that's Brown's Grocery out of Philly, and they do try to locate in more underserved communities and urban areas. So yeah, I think this is an ongoing challenge that we're trying to unlock. And Amy alluded to it. Typically, groceries look at like a 5-mile catchment radius for their you know, retail sales, and the fact that you have several others within the 5-mile circle make it difficult. And then, yeah, you don't have a traditional grocery type
Okay.
site. So you really need an urban grocery format, and they're looking for, you know, density and population growth in the immediate area. So I think as more housing comes in, the market may change for the grocery, and different incomes coming in as well may affect that. Amy?
I think one of the other pieces too is we have a decent amount of corner markets, and many of them don't carry fresh produce. So I think trying to make a better effort to get those kind of grocery needs as opposed to just your snacks and you know, quick takeaway items would be really beneficial. It's something I wish I could. It needs someone to completely focus on to really get
Well, you know,
markets on board, and then also have that refrigeration and you know, cooler needs and have that turnover to it.
Right.
Yeah.
we have been funding Nurture Nature and Kellen in working on the cornerstone or corner store program, where Kellen has, since they have to be out picking up stuff at the farmers anyway, they can distribute it to the corner stores, takes the cost way down. And Nurture Nature has been working to get their vouchers, the various vouchers and that type of thing into their hands, but it's a tough sell even with the corner store owners.
Paul, how are they bringing corner store owners on board?
They're going out and talking to them.
Okay. Who is Kellen or Nurture Nature?
Nurture Nature
Fresh by
and
Local.
Kellen. As I say,
Okay.
Kellen has been working hand in hand, but it would be worth talking to Nurture Nature about. I don't have all the details, but we do fund them. And that's a big part of it. I could
And
go
that,
back and look.
That's through Buy Fresh, Buy Local, correct?
Buy fresh, buy local, yes.
There is a program here in Philly that it actually gives some type of incentive or through donations of fresh produce to local bodegas or corner stores. That's how they are actually getting the bodegas to start carrying fresh produce. But then talking to the bodegueros, so they mention like, well, now we got all this produce, but like we're not selling it, so it just goes bad in the shelf. So then what they started to do is give out coupons, so that the people that are coming into the bodega, they say like take an apple for free or something, and that way at least they are rolling out the inventory. But I also think that adding another layer is that there needs to be some type of outreach as well, as to having community classes or some type of like education around healthier foods, so that people don't, so that the food doesn't go bad on the shelf when people don't buy it.
And one of the things that Carolyn Server did a nice job at the Paxenosa Food Pantry is it's an international food pantry. So it has culturally appropriate foods as well. So that might be helpful, as well as making sure that even if there's pop-up farm stands or something like that, that they accept double SNAP benefits. So we're tied into more of a sustainable model as well.
I love that. That's huge. Like the double SNAP benefits when they buy healthy foods. Like I saw that also, now that you reminded, I saw that on a farmer's market here in Philly.
So can I share something that might benefit, since we talk about transportation?
Sure.
We have a new self-navigating platform that we're working on called Find Help, and LVHN is using the same platform. We might be at different stages of it, but what that means is we met with 2 transportation partners about this yesterday. Lanta, which is for this county, as well as Easton Coach. So we have those contacts. Amy, I'm sure you already have those contacts with like Matt Chasky, Michael Taylor, Jean Marie McDyer from Easton Coach, and then Lanta was Daryl Littner. But it means that if you have our app or you go to our federally qualified health center and you put in your zip code, you could search in a very health literate way, food, transportation, housing, financial help, so forth. So then a bunch of businesses, organizations pop up, and we're working with them to get them claimed so the information is accurate and the information can be updated timely. Now, for the community that doesn't have a phone or an app or access to a computer, our case managers are getting trained on that, and our community health workers. So that means if we're working with patients, whether it be at the FQHC, or this is what we're doing in combination with our hospital and the FQHC, is that we, our case managers or our community health workers, follow up directly with that organization. So we could say, hey, Lanta, we have a patient that needs transportation. We're going to send over XYZ, okay? And then we can kind of track those referrals and those connections to care on the inside, as well as on the outward facing. So outward facing with our app and with our websites, and inward facing with our communications and our staff. So we have all that information. I'm guessing you're already talking to those transportation partners, but if not, and you need any contact information, let me know. And we can also provide updates on how that's going with Find Help, because, you know, we have to look at those other alternatives on how to improve those connections to all of those social determinants of health, essentially is what they are. And they
Rosemary,
barriers.
that platform is available just to the general public to use?
Find Help, yes. You don't have to only go to St. Luke's to access it. You can go just to findhelp.org and look at that. And like I said, the good news is both hospital networks are using the same platform. So let me, it's equivalent but different to 211. So 211 is where you can pick up your phone and call. The difference is 211, someone answers the phone. This is self-navigating platform. However, behind the scenes, we're working on that communication, that we can pick up the phone. And so, you know, trying to make it work the best it can.
Rosemary, I would love a connection to Lanta. We actually had a woman who lived in the West Ward that was higher up there, but we've lost contact with her. So if you have a Lanta
Yep.
connection.
Okay, I will connect you in an email to Daryl.
Perfect, thank you.
Great. That's awesome. So we are running into the second half of the meeting time. Do you guys want to start discussing solutions or ideas for potential partnerships or projects that we don't have to find out how they would take off right now? We're in this stage of like what would ideally the outcome would look like.
So I think we did discuss some action items, right, about additional projects. So, you know, even just what me connecting Amy to transportation and integrating like that platform, Find Help, which is going to help, you know.
Exactly. Thanks, Rosemary.
And then as far as Kellen goes, I think what Paul brought up was a good point. Funding's already going to Kellen and Nature Nurture. And an update from where that is, if they need any help with that, you know, are they using the best practice? Are they making sure, you know, just like it's important to, I guess, know where we are before we know where we're going. So just a touch base on what do we have that we can build off of. And that's working or needs tweaking. Again, even that walking route I put in the chat for Paxenosa, is that still something that I haven't walked in a long time? I mean, I can go with our liaison and walk it, see if it's still a good route, but things like that I think would be helpful to kind of do some homework.
Definitely.
Yeah, and I think things like the walking route, there's also an overlap with our working group tomorrow on transportation open space. So we'll bring that up during that discussion as well, because I do think that there is a real need to create safe and accessible walking routes through the neighborhood and bicycling routes, and to also connect some of the schools and the open spaces in a way that is more safe and more attractive and more pleasant. So I think that's a great one to discuss overall with that group.
We have
Wasn't there a,
walking routes that I'll send over too. So I just don't,
Yeah.
they weren't on the website, but I'll find them.
Great, thank you.
wasn't there a walking bus concept that was being looked at using the ambassadors? That was part of that connectivity program?
Yeah, you're right, Paul, there was, and we've just, it's just been trying to get it together and also funding for the ambassadors. And I think part of it too is that 921 Spruce Street isn't finished yet. So to be able for the ambassadors to start that early, there's some logistical challenges right now. I know you missed our last steering committee meeting, but the ambassadors are changing their territory this year, and they're going to be primarily on Northampton Street between 6th and 13th Street. So I think,
see that, yeah.
Yeah, it will. I think that's going to be the start to some other efforts like that walking school bus that we've talked about. You know, and then as 921 Spruce Street gets finished, I think that will be another big piece to this. So yes, I think that Andrea, that would definitely be a great, I mean, that goes on so many of these boards actually, but the concept of having an adult that can help walk kids to school through our ambassador program. So if they don't have a parent that's able, or, you know, there's other barriers at home with with parents or older siblings, that there's a kid can walk out the door and be met with a group that's walking together of kids with an adult. And then also the safety aspect of that as well.
That sounds
it's-
really awesome.
It's Rosemary, it sounded like the walking bus thing was exactly what you were talking about.
Yeah,
Yeah,
it was
so
hard to pull off, but it's a great
I
time.
was impressed when I first heard about it with the Westward.
Yes.
Rosemary,
Oh.
can I ask for the Walk Works program? Were they led for, X number of months?
Actually, Janet Meets from Two Rivers led some of our walks. But we had a children's center. We had some of Todd Namora, who used to be our liaison. I think you knew him, right, Amy? I think I
Yes.
asked you that last time. So with the children's home, he would get some of those children out, and we did some walks, I think even with Janet, and then some of those students, but it was really hard to get people mobilized. Our vision was to try and even get local organizations, and we worked with the Westward Collective Impact, Promise Neighborhood at the time, to really kind of get it going. But there's I think what happens is there's such high needs that something like walking falls to the bottom. But the infrastructure was there, and we had commitment. Like I said, Dave Hopkins even put signs up, and it just was hard to keep going.
Yeah, absolutely. Absolutely. We experienced that as well. Yeah. I think there's, and just like a general comment, I think there's merit to having people lead these things, so that that if you show up, there's always going to be one person there to walk with no matter what. And, until like an established group gets going. We've been very successful with the things that we do at Paxinosa because it's a walking school. So many of the
Right.
parents walk the kids there. So if there was something, for those parents that don't have to go to work, if there was something that stepped off, immediately thereafter, we would probably get a good group of, especially moms, that would probably walk with a group, for 30 minutes or so. So I wonder if that could be, a piece. And because Paxinosa does so much programming over the summer, you could probably keep it consistent year round then too.
I think there could be a way to provide an incentive. I know my wife has a Fitbit, and if she walks 10,000 steps every day, she gets like $3 towards her healthcare benefits or something I think it's through her insurance, but that adds up over time, if you, and so I don't know if it could be done through the hospitals or through another method, but to provide a small incentive for people to get out and get those steps.
Yeah, the Delaware and Lehigh Canal has a program called Tail on the Trail, and they encourage people to walk a certain distance, and depending on that tier of distance, you're rewarded with a hat or a t-shirt or so on and so forth. And they do it at least twice a year. They do a winter one, and then like one from the summer into the fall. So that is there. And I know there's also apps, like what Adam, you talk about. I have an app that it automatically uploads Fitbit data or, phone data. And then once you reach so many points, you get $10. So yeah, it adds up over time. Yeah, it's a good thing. Yeah.
Maybe part of it is finding low cost Fitbit, watches or whatever it is that can be distributed to people who aren't able to afford them. Yeah, or through the phone.
Yeah, through the phone. Yeah.
Yeah.
Mm.
So I did find the other walking routes, because we had 4. So one was around Cheston, 2 were the Westward, and 1 was downtown. So I put them all in the link, as well as the website from pa.gov that kind of houses it all. And we did try to tie it into Tail on the Trail, what Amy mentioned, because with Tail on the Trail, you log in, you earn incentives automatically. And there's opportunities to incorporate, like we could get, this has worked in other schools, where you get like the athletic director for the Paxanos is an elementary school, so Easton Area School District, or the football team, or you get those champions to step up and lead the walks. And we can try a different angle, and that's something we could all kind of get behind if those walking routes are still good. So again, we can step up, and I can ask Jackie, maybe one day her and I go walk these routes and make sure that they're still good. And then maybe, like I said, we did a full blown out assessment with transportation to make sure they were safe walking routes. And I don't know who we would use to actually get the thumbs up that they're still safe, because I don't know that I qualify to say that they're still safe, but I don't know if anyone has any ideas about that. But
I think it sounds really,
found them.
I think it sounds really great, and we should totally test them. And then, like, if everybody agrees, or I don't know who we need to sign off on them that they are safe, I think that we should like promote them, like print them, make posters of them. Like, I'm sure that people at the Bushkill House or at one of the community rooms in one of our target sites, if we post them, like, check out the new walking route, or even if it's not new, just like by saying something about them, we could start attracting people to doing it and engaging on it.
I have a question, Adam. Is the purpose of the working groups to focus on input for the plan? So
Yeah,
would it be
absolutely.
possible, I think you mentioned at the bottom, those green Post-it notes, that those were specific to the sites, the target sites.
Mhm.
Would it be possible to get that information?
Yeah, so we're putting together a whole summary of the entire survey that will be completed fairly soon, and we'll get that out to all the working group members. We just recently wrapped it up a couple weeks ago, so we didn't have the full kind of detailed summary ready to go yet, but we just wanted to pull out some key points. But yeah, we can definitely share that. We'll have it up on the website, and it'll be all public.
I mean, I just wonder, are we supposed to be just focusing on those sites?
Yeah, so it's interesting because our planning area is the entire neighborhood. Our target housing is really the housing authority properties. The residents that we want to create projects and strategies for are both populations. So we really want to be able to come out of this effort with projects that will help those housing authority residents, but will also be available and be able to improve the quality of life for the neighborhood residents as a whole. So it's kind of both. I would say maybe there's a little bit more focus on the public housing residents through this
Okay.
process, because with the Westward neighborhood plan that we completed a couple years ago, that really took the broad look.
Right.
But at that point, we hadn't really engaged with the public housing folks. And we know that they're of the greatest need in the neighborhood. So if we can develop projects for them, I think that kind of kills two birds with one stone, while also providing availability for other people to access some of these things.
Right. Thanks.
Yeah.
Thanks for clarifying that. One other question. Assuming that the plan is put together and we get the implementation funding, are the restrictions, I mean, does that funding, is it only bricks and mortar, or does it?
No, it's,
I don't know.
so yeah, so the new implementation round from this year is anywhere between 30 and 50 million dollars. So they actually
Right.
raised it this in 2021. Of that, there's a certain percentage that has to go towards housing, and then a certain percentage that can go towards critical community improvements, which are more the neighborhood
okay.
projects. And then there's a percentage that can go towards the supportive services and the people projects, the programs. So you can use it for all three of those. And
Great. Okay.
I'll have to go and check again at the latest NOFA to see how they break out the percentages, but I think it's somewhere between like 10 and 15% can be used for neighborhood improvements. And somewhere around, I think it's 10 or 15% would go towards more programs. And then the rest goes to rebuilding the housing. So somewhere in that ballpark.
Okay, thank you.
Yep.
Awesome. We are
We should-
almost, yes.
Let me just jump in on one more point because it's kind of connected to what Paul was mentioning. Andrea, if you want to zoom up to the Vanderveer Park images at the top of the board. So just so everybody knows, we do have funding in this grant cycle, in the planning grant, tied to early action projects. So we are currently looking at utilizing some of that HUD funding for the first phase of improving Vanderveer Park. And so everyone knows kind of what it looks like today. There was a concept design done recently, which is the middle drawing there. And so we're thinking about whether we can, in the next year, really get that started with the eastern portion of this plan, which looks like a parking lot here, but we're really envisioning it as like a really vibrant play space that could be multi-purpose. And so there's some imagery for like what that could look like.
Yeah, great.
Where you'd still be able to park on it for football games, but all the rest of the time it's used as, this amazing kind of adaptable play space, and where we could have programs like Zumba classes and other things going on. So we're hoping to be able to move that forward within this next year. And we're working with Parks and Recreation on that particular project right now. So that's our early action project.
Great.
Yeah.
That's very exciting. Thanks, Adam.
Yep.
So we are in the last 5 minutes of our meeting. I want to open it up for questions, concerns, etc.
This
I would
was
say that-
great. Thank you for having us be part of it. We really appreciate it. We're excited to get involved again.
Great having you, Rosemary. Seriously, your input is very, very, very spot on and very appreciated. We look forward to having you at our next meeting too.
Yeah, it's sometimes when you have a smaller group, it's harder, but other times you would have a really amazing dialogue and conversation like today. So thank you both for really being involved and helping us begin to flesh this out. So Andrea, why don't you tell them a little bit about the next two meetings, the February and March, and kind of what we'll be doing there. And then I think the other main thing is we have other people signed up for this group, so we need to plug them in and then reach out to some of these other partners between now and February to grow our conversation.
Thank you very much. So I'm actually not ready, Adam. I apologize. I need to pull up my calendar. I want to give you guys just a second. I want to give you guys the date for the next meeting. It's going to be about sometime in February, but I don't have all of that yet. So please bear with me.
I think I got it here. Let me see.
Wednesday, February 23rd at 9 a.m.
There you go.
Yes, if you guys can save the date, Wednesday, February 23rd at 9 a.m., we will be meeting again. Hopefully the folks that missed this meeting will be joining us as well. The recording is going to be available if anyone wants to catch up, like any of the folks that missed it, if they wanted to catch up on what they missed. We can make it available upon request. And then in the next in the next steps, we will be following up with themes and the actions that we determined today. So we're going to be doing a little bit of a summary there, and then we take the initial ideas that we are having today, we are taking them closer into implementation or closing into planning how they're going to be used in the plan. So that's the next stage.
Yeah, and I think in doing that, we'll be at the February meeting, we'll be prioritizing some of these project ideas. We have 20 to 30 things on the board now. How do we really figure out what are the highest priorities for the group and start to rank things a little bit? And then the third meeting, really getting into the details of the partners for those priority projects and whatever implementation resources could be available that we can plug into. So it's kind of an iterative process.
Adam, I thought at the end of the last meeting we had where we identified the working groups that we were willing to participate in. I thought that I had, and apparently I didn't, because I didn't get an invitation for the housing group, which I think meets this afternoon. Is it too late to become part of that?
No, I'll put you on the invite and I'll add you to the roster.
Thank you.
Yeah,
That's
no problem at all.
today at 3:30. So
Right.
just
I saw
so
it,
you're-
I saw it and I thought, wow, maybe I know I had a little trouble with that at one time, so maybe it just didn't come through. That's great.
No
And
problem.
Amy,
Yeah, we'll put you in there.
Amy, should I have Kathy Trimble, it's Kathy Trimble from Pine Brook, contact you?
That'd be great, Paul.
I'll do that.
Thank you.
Rosemarie, it's great seeing you.
Thank you. It's great being here. And I know Raj is going to be on the housing committee meeting later.
Oh, great.
Yeah, I saw him. I see him on there.
Amazing. So thanks everybody for your time. Thank you so much for your super valuable input. I look forward to seeing you at our next meeting, and I hope all of you guys have a great rest of your day.
Great. Thanks, everyone. Have a great day.
Thank you.
Thanks.
Bye.
Bye-bye. Thank you.
Thanks, everybody.